Well, I have to say that I wasn't prepared that after PE lesson I have to read it aloud. But, dear conference participants, thank you for inviting me today to your international conference. Unfortunately, on the same day, the Active Hungarian Conference is taking place in Mezőköves, where I am one of the hosts. Our topic there is similar. We are discussing how to encourage people to move more and more and live healthier lives. There is only one thing that you need, health. The rest you can buy. This is a famous quotation from a Hungarian comedian, Géza Hofi. He reminds us how often we take health for granted until we notice pain here and there, struggle to climb the stairs, experience neck discomfort, or face more serious health issues. Sedentary lifestyle has become a widespread issue in Hungary. That's why we launched the Active Hungary program to ensure health, so that Hungarians can live in an active, healthy, fulfilling way. If we follow our planned path, children will learn to love physical activity at school, doctors will prescribe exercise as a treatment, people with disabilities will have the necessary tools to engage in sports, mayors will bike to work, grandparents will jog on running tracks, and even pensioners in their 90s will stay active in social walking groups. Hungary has the highest rate of preventable deaths related to lifestyle choices in the European Union. The life expectancy of Hungarians falls by 4.6 years shorter of the EU average. This figure is 4.1 for women and 5.3 years for men, and many spend a long proportion of their lives suffering from chronic illnesses. According to the WHO, lifestyle influences health more than any of the other factors, 43%, followed by genetics, 27%, and environmental impacts, 19%. Contrary to popular belief, healthcare services only account for 11% of our overall health outcomes. Thus, healthcare advancements alone won't lead to progress without lifestyle changes. Within lifestyle, diet, harmful habits, and physical activity have the greatest impact on health. In the active lifestyle strategy named after Charlotte Monspart, we emphasize that the need to shift from a disease and hospital-centered healthcare, we need to focus on prevention, which encourages active lifestyles. In Hungary, a sedentary lifestyle is directly linked to 2 to 3% of total healthcare expenditures. This amounts to nearly 100 billion Hungarian forints annually, a burden that could be significantly reduced by improving physical activity rates. Enhancing physical activity levels is also crucial for the country's competitiveness. I wholeheartedly applaud all initiatives that highlight the importance of movement and physical activity. I sincerely congratulate the European region of World Physiotherapy for its new position paper recommendations. It is up to us to show our children, young people, families, seniors, people with disabilities, the less fortunate and well-off alike, that movement is a joy and it makes us feel better in our everyday life. Thank you again for the invitation and the opportunity. We can achieve our goals if we move forward together with the healthcare sector. With gratitude for your attention, I wish you a productive discussion and exchange of experiences in the field of health promotion. Máriusz, Révész.
Good afternoon. It is a pleasure to represent WHO Europe in this session and to support physiotherapy's important work in the Non-Communicable Diseases area. My name is Romeu, and I am part of the special initiative on NCDs and innovation of the WHO Europe. I want to congratulate the organizing committee and thank especially to Europe Region World Physiotherapy for the invitation. The global burden of NCDs is growing very fast, and we have now a very well-established Big Five with cardiovascular diseases, cancer, diabetes, chronic respiratory diseases, and mental health conditions. And these 5 areas of diseases have 5 main risk factors, with 4 of them related with behaviors, including physical inactivity. So this is a very pragmatic perspective that I want to give you on this very short presentation. The physiotherapist is the most trained and skilled health professional to tackle physical inactivity, mainly through exercise programs, especially in the most vulnerable populations. In order to set the WHO NCDs Global Action Plan, several goals were established with WHO member states, including a relative reduction of physical inactivity by 50% by 2030. The promotion of physical activity should be one of the flags of NCDs prevention and control worldwide. However, physical inactivity is increasing in most countries in the past 20 years, and we are not on track to accomplish the goal that was set, thus compromising NCDs prevention and control. Many experts think that member states might not be giving enough attention to the WHO recommendations to tackle NCDs and its risk factors, specifically the best buys based on cost effectiveness. To strengthen this, a new report was published in 2024. And if you look to the physical activity best buys, opportunities for physiotherapists are everywhere. Let's check. One of the best buys is totally focused on healthcare settings, recommending physical activity assessment, counseling, and support for behavioral change through brief interventions. This is totally aligned with the WHO physical activity strategy for the European region and advocates that all health professionals, including physiotherapists, should integrate physical activity into prevention, treatment, and rehabilitation. Another recommendation is to implement multi-component workplace physical activity programs, which Europe Region World Physiotherapy is already developing. And finally, the most cost-effective action is implementing communication campaigns to promote physical activity with links to community-based programs and opportunities, such as cardiac or respiratory rehabilitation or workplace programs such as the Move at Work campaign. Besides physical activity, physiotherapists can also tackle other behavioral risk factors, such as unhealthy diets, alcohol, and tobacco, and with an integrated approach. WHO Europe has been developing the BRIEF project, and the manual on how to integrate brief interventions for NCDs risk factors has already been published. This manual aims to train health professionals on how to use the 5A's brief intervention model and to help patients to change their lifestyle, where realistic algorithms are according to the time of the consultation. We invite you all to analyze this manual and to disseminate it. We thank again the opportunity and keep in touch with us.
As a president-elect of the Hungarian Society of Cardiology, it is a privilege to welcome you all to this critical session on harm reduction, exercise, and prevention, which stands as a beacon of the Hungarian EU presidency's commitment to addressing the profound challenges posed by non-communicable diseases. As we gather here today, we recognize that NCDs, including cardiovascular diseases, diabetes, chronic respiratory diseases, mental health conditions, and cancers, as you can see on this figure, impose an ever-growing burden on our societies and healthcare systems across Europe. These conditions are responsible for nearly 80% of the disease burden in EU countries and represent the leading causes of avoidable premature death. This slide, you can see the cardiovascular disease burden, which differ in the entire world significantly. And the next slide, you can see the disparities in the prevalence and the incidence of diabetes also in different countries. In recent years, the COVID-19 pandemic has reminded us that NCDs not only lead to high human and financial costs, but also leave individuals with these diseases more vulnerable to other health crises. As Europe's population ages, the prevalence and impact of NCDs are expected to rise even further, demanding our immediate attention and action. Among the many factors driving this NCD epidemic, physical inactivity stands as one of the most significant. insufficient physical activity is a common threat across nearly all major NCDs and is a substantial risk factor that we as healthcare professionals can address. This is where physiotherapy emerges as a unique and powerful tool in our prevention and management efforts. Physiotherapy not only facilitates active recovery and rehabilitation, but also promotes preventive practices that encourage regular physical activity, benefiting individuals across the entire continuum of NCD care, for primary prevention to long-term rehabilitation. Despite robust evidence supporting the effectiveness and safety of physiotherapy in both the prevention and treatment of NCDs, its potential remains underutilized in many European healthcare systems. We have before us a valuable opportunity to change this reality. Today, we are honored to have the European Physiotherapy Society's NCD expert committee present their position paper on the role of physiotherapy in the prevention and management of NCDs. This paper underscores physiotherapy's integral role in NCD management and calls upon healthcare stakeholders, policymakers, and practitioners to recognize its potential as a part of a comprehensive interdisciplinary approach to combating NCDs. It synthesizes current evidence and best practices, offering a roadmap for integrating physiotherapy more effectively into healthcare strategies across the continent. I believe that together we can elevate the status of physiotherapy in NCD prevention and management, promoting a future where our healthcare systems fully leverage this resource to benefit patients, practitioners, and public health at large. I would now like to invite Professor Grainne to introduce the position paper, which we hope will serve as a catalyst for a strengthened commitment to combating NCDs and improving the quality of life for millions across Europe. Thank you for your attention.
The other reason I'm so delighted to be here, as a physiotherapist, I am passionate about the role of physiotherapy in the prevention and management of non-communicable disease. 15 years ago, I did my PhD in this area, and I've been banging the drum for the last 15 years to get us recognised as the experts in this area. Just to introduce myself, my name is Grainne. Excellent effort. I'm a professor of physiotherapy in University College Dublin in Ireland. I worked for a long time as a clinician before entering the world of academia. I'm the director of the physiotherapy program in UCD, where I teach the next generation of physiotherapists about the prevention and management of non-communicable diseases. And my research focuses on exercise as medicine, lifestyle and exercise interventions for chronic disease, especially obesity and type 2 diabetes. Today, though, I'm here in my role as the lead of the Physio Europe group on non-communicable diseases. And my aim is to summarize our paper and make you aware of the wonderful and, I suppose, excellent contribution physiotherapy can give towards prevention and management of non-communicable disease, so you're better informed when it comes to key decision-making processes around EU health. So over the next 10 minutes or so, I will introduce you to who we are, the Europe region of World Physio, say a little bit about physiotherapy in Europe as it currently stands, detail the life in the day of a physiotherapist to provide those of you who don't know what we do on a day-to-day basis with a clear understanding. We'll talk about the burden of NCDs in Europe for fear of repeating what has already been said. And I will talk about physiotherapy in NCDs, using exercise prescription as an exemplar. Before I summarise our role on prevention, management and advocacy, I will then hand over to my colleagues who are sitting here in the front row, and they will talk about some of the most burdensome of the NCDs, cardiovascular disease, obesity and type 2 diabetes, and mental health. So, who are we? The European Region of World Physiotherapy is a non-profit, non-governmental organisation that represents the interest of the physio profession in Europe. We have a membership of 38 organisations representing approximately 200,000 physiotherapists across Europe. We represent physiotherapy profession by driving excellence in education, practice and research by advocating and influencing health policy. And physiotherapy in Europe? Physiotherapy is a statutory regulated first contact healthcare profession. It is the third largest health profession in Europe, with over 600,000 physiotherapists working here, which means we have about 137 physiotherapists per 100,000 inhabitants. Varying in Germany, there's over 200 per 100,000, whereas in Romania, there's approximately 15 physiotherapists per 100,000 inhabitants. We are the primary non-invasive healthcare profession. We use health education and exercise prescription, which has been shown for many diseases to be as clinically effective as medication and surgery. Physiotherapists have a wide reach. In most countries, we span primary care, acute hospital settings, specialist areas, community settings, NGOs and charities. Our expertise is integral to all spheres of health and well-being, including promotion, prevention, rehabilitation and rehabilitation. We are uniquely qualified and positioned to play a pivotal role in meeting the needs of people living with or at risk of NCDs. So this slide is here to illustrate the day in the life of a physiotherapist. It highlights the array of responsibilities, skills and expertise that we possess as physiotherapists. In any one day, a physiotherapist will educate clients and families on the importance of healthy lifestyle behaviours, especially physical activity, in maintaining and managing chronic conditions. As first contact practitioners, they will diagnose, assess and provide individualised treatment programmes for varieties of conditions. We see between 5 and 15 patients, sometimes face-to-face, other times utilising telehealth, to offer virtual consultations, ensuring accessible care to clients in remote and rural areas. We're autonomous practitioner, meaning we're characterised by independent, self-determined professional judgment and actions, and we keep up to date with the latest scientific research to ensure we employ evidence-based interventions. The majority of clients we see as physiotherapists on a day-to-day basis are clients who live with one or more non-communicable diseases. And for fear of repeating what you've heard already, I'll rush through the slide, I guess. There are 4 main non-communicable diseases: cardiovascular disease, cancer, chronic respiratory conditions, and type 2 diabetes. But I would argue as a physiotherapist, we should also be including degenerative neurological conditions, musculoskeletal degeneration, and mental health disorders in this list. You can also see we have a list beside the 4 main types that includes risk metabolic factors as opposed to chronic diseases themselves. These metabolic factors, such as obesity and hypertension, are as worrying as the NCDs themselves. 60% of adults in the EU are living with obesity and almost 30% with hypertension. The burden of NCDs in Europe is massive, with a significant effect on both mortality and morbidity. They are responsible for 90% of deaths and 85% of years lived with disability. From an economic perspective, we're looking at spending 700 billion a year on the treatment of NCDs. And I might just rush through this because we've already heard this from somebody else, but just to let you know what might be interesting when we're talking about physical activity and exercise. In the EU, there are 1 million deaths per year and 8 million disability-adjusted life years attributed to physical inactivity, costing us approximately 80 billion. So why physiotherapists? We're first contact practitioners with excellent communication skills and well placed to promote healthy lifestyles. Our professional training prepares us to not only practice in healthcare settings, but also trains us how to use this knowledge and expertise in the community. Our practice pattern is consistent with the needs of effective health education and behavioural change. We spend on average 30 minutes with clients and see them over regular times. Our strong focus on secondary prevention is vital for maintaining function and independence, preventing patients from returning to acute hospitals and allowing them to stay in their own homes for as long as possible. And lastly, and perhaps most importantly, we are extremely skilled. We are the profession, the healthcare profession, when it comes to physical activity promotion and exercise prescription in the context of NCDs. I believe exercise is truly medicine. The logic behind exercise as medicine is that physical activity and exercise should be recognised, assessed, and prescribed as a vital sign of health. Exercise should become integral to healthcare models precisely to address the epidemic of NCDs that are closely associated with physical inactivity. It is one of the most powerful interventions to prevent and manage NCDs. Analysis of worldwide burden of disease estimates physical inactivity is responsible for 6% of coronary heart disease, 7% of type 2 diabetes, and 10% of breast and colon cancer. Exercise currently remains underutilized, underprescribed, and frequently overlooked in favor of pharmacological and surgical interventions. It is unequivocally clinically and cost-effective. A recent meta-analysis of 46 RCTs concluded that physical activity and exercise interventions should be included for routine implementation in primary healthcare due to the... Oh, hello? Am I still here? Sorry, I thought it was gone. Due to their clinical and cost effectiveness. However, exercise is currently only mentioned at 1/3 of healthcare professional consultations with people who live with chronic disease or at risk of it. And even fewer are signposted or provided with individual exercise prescriptions. Enhancing healthcare using exercise prescription is a low-cost, effective approach to maximising health at population levels. Using physiotherapists, we can ensure a better world exists where generic advice such as get up and move, go for a walk is replaced by specific exercise recommendations that include the same detail afforded to medication. In other words, exercise A taken n times a day by X duration for weeks, months, years. To optimally prescribe exercise in the context of chronic disease prevention and management, knowledge of how the physiology of exercise training interacts with both the pathophysiology and medical management of the patient's chronic condition is vital. And physiotherapists possess the knowledge and skills to be the ones to do this optimally. We are the experts in physical activity and exercise promotion and are the profession to lead this assault on non-communicable diseases. There is grade A evidence for physiotherapy in the management of cardiovascular disease, pulmonary disease, MSK disorders, and many neurological conditions. There is also emerging evidence to show physiotherapy-led health promotion strategies work. Some recent publications by the Europe region of World Physiotherapy or their member organizations have focused on cancer, pain and mental health, and the role of physiotherapy in weight management for adults. There is an extensive body of literature reiterating what I'm saying and confirms the importance of physiotherapy in Europe's fight against NCDs. So we're ready. Physiotherapy, our profession, ready, willing and able. We have a key role in the prevention of non-communicable diseases in Europe. We can incorporate concepts of wellness, fitness and health promotion into every client consultation across the lifespan, considering diverse needs within a community setting. We have a key role in the management of NCDs in Europe by applying best evidence in selecting, prescribing, and using lifestyle and exercise interventions to help individuals optimize functional ability and live their best possible lives. And we have a key role in actively advocating for the prevention and management of NCDs in Europe. We can support scientific, educational, legislative and other policy initiatives that promote regular physical activity and exercise to enhance health and prevent disease. The European region of World Physiotherapy is calling on the WHO, the EU and national health policy makers to recognise the unique and essential role physiotherapists across Europe can play in tackling the NCD epidemic. So before I finish this, I'd like to acknowledge the team who've been involved in putting together our paper, and you're going to hear from them soon. And thank you all for this opportunity to present today.
Well, actually, the important slide, the important number was that in Hungary there was the number of the preventable deaths is more than a double than in the average in the EU. And also what we would like to tell that the number of the myocardial infarction is changed in Hungary in the last years. In 2003, the number of the myocardial infarction was 11,000 in Hungary, and it changed to the 2014 to 5,800 myocardial infarction per year. But this number is not changed. And in the last years, we put much more money into the preventable disease of the cardiovascular field, but there was no large changing. So what we are waiting now, and what we are waiting for this position paper, is a kind of changing in the numbers and a kind of changing in the preventable diseases. So thank you very much. In the name of Professor Csanádi.
Thank you for the opportunity to address this distinguished audience today. I am delighted to be asked to talk about the role of physiotherapy in cardiology. As we already heard, the World Health Organization reports that a lack of sufficient physical activity is linked to hundreds of thousands of deaths each year. This highlights the critical role of movement and exercise in health maintenance. Evidence shows that physiotherapy is a leading approach among harm reduction factors for health. It provides guided support in preventing and managing diseases. In terms of availability, there is a wide coverage across European countries. However, research by the European Journal of Preventive Cardiology demonstrates that the availability is on average limited to 1 cardiac rehabilitation spot per 7 ischemic heart disease patients. In this presentation, I will summarize the current role of physiotherapy in cardiology, focusing on its contribution to the prevention and management of cardiovascular conditions. This slide details the benefits of the exercise on cardiovascular system. Those benefits appear in 3 main branches, namely vasodilation and angiogenesis, mitochondrial biogenesis, and inflammatory effect. Recent research from the European Society of Cardiology highlights 3 key papers. 2 position papers, one on the standardization of cardiac rehabilitation programs in Europe, and another on implementing the standardized program. The 3rd paper presents the latest guidelines, offering recommendations on cardiovascular disease prevention in clinical practice. The evidence from these 2 position papers and the guidelines shows core components and objectives common to all clinical conditions. Starting point is counseling physical activity in order to increase activities in daily life. Exercise training should be prescribed on an individualized approach after careful clinical evaluation, including risk stratification, behavioral characteristics, personal goals, and exercise preferences. Training consists of submaximal endurance training and resistance training. Such individualized exercise prescription is the specific contribution and expertise provided by physiotherapists. In the 2021 ESC guidelines on cardiovascular disease prevention, there are 5 recommendations regarding physical activity. 4 of these recommendations are based on first-class evidence, and 1 is particularly strong. It is recommended that adults of all ages aim for at least 150 to 300 minutes per week of moderate intensity aerobic physical activity, or 75 to 150 minutes per week of vigorous intensity aerobic physical activity. This will reduce all-cause mortality, cardiovascular mortality, and morbidity. There are also moderate recommendations on reducing sedentary behavior and incorporating resistance training. Several studies have been performed regarding the cost-effectiveness of cardiac rehabilitation. These studies all confirmed that cardiac rehabilitation is indeed cost-effective, especially with exercise as a component. I am pleased to inform you that currently in Hungary, there is a new initiative in which medical and physiotherapy guidelines are being developed in parallel and in alignment with each other. We welcome the ongoing work on the new EU guideline for cardiovascular rehabilitation, which is currently being developed with an expected release in 2026. The chair of this guideline is a Swedish physiotherapist, Maria Bach. The latest research from the ESC has proven what we already knew. That is that physiotherapy plays a critical role in the treatment of cardiac health issues. Thank you very much. Thank you kindly for your attention.
I think all of us know well that obesity is a chronic relapsing disease which leads many other NCDs, especially in the European region. Overweight and obesity altogether takes around 60%, and this is a key risk factor now for NCDs. Here, in the latest and newest data of obesity prevalence, BMI above 30 shows in the world ranking, Hungary is in the place of 21st, and in the European countries, the prevalence is between 19 and 36 in men. Worldwide, in women, the situation is worse, but in Hungary, we are much better position, ranking on 84 between the world countries, and in the European countries, the women prevalence between 32 and 36%. No any countries will reach to stop obesity until 2035 by the WHO report. Even in Hungary, it shows how increasing the prevalence. In a multi-cohort study shows that the healthy, and this is freeze life expectancy, decrease by the body mass increase index elevation. And the risk of developing multimorbidity increases significantly above 35 BMI. In the inactivity map, 30% of the adult population and 80% of the adolescents doesn't reach the recommendation of physical activity. Here you can see the obesity prevention physical activity pyramid, and also the European Association for the Study of Obesity has the guideline to take care of obesity. All of them meet in the multidisciplinary treatment. The physiotherapists hardly involved, necessary to involved. Increasing the severe obesity worldwide, so also it's needed the multidisciplinary treatment, and it needs to care of the people living with obesity inside the healthcare system. In Hungary, we established in 2022 a Stop Obesity Prevention platform involving the relevant scientific societies and also the governmental party. We started to work together. WHO acceleration plan also shows that the most important to stop obesity, to have a good sport system, good sport facilities, and the adequate physical activity for everybody. Also, in this acceleration plan, the frontrunner countries use the physical activity prevention programs, and it's one of the main points how to stop obesity. I think it's time. Now it's time to take action, not only speak about, not only realize the number. Now we have to start to act together. Thank you very much.
The effectiveness of physiotherapy in diabetes, obesity, and weight management. We all know about the good effects and benefits of exercise in general, but let's see the benefits of exercise on the glycemic control. Regular exercise increases insulin sensitivity, improves the short and long-term glycemic control, improves the aerobic fitness and the vascular system, vascular function. It is recommended that aerobic training, it's reducing the fat mass and the body mass, added up with resistance training for increasing the lean mass. High-intensity interval training is believed to be successful at lowering the blood glucose, and afternoon and post meals exercising is said to be better results than the morning and pre-meal exercising. So according to research, regular exercise is an independent treatment that can prevent, delay, and reverse type 2 diabetes. Also prevents the metabolic disease and the premature death through its effects on central adiposity. Thus, regular exercise and physical activity should be encouraged and promoted to improve and manage glycemia, independent of weight loss, for the enhanced health and well-being. Undoubtedly, physiotherapists have a great role and vital role in both the prevention and the management of obesity and diabetes. Let's see the role in the primary and the secondary prevention. They take part in promoting regular exercise, physical activity, and healthy lifestyle. They take part in the prevention of weight gain, screening for risk factors, and they provide education and guidance according to the recommendations. The physiotherapists play a vital role in the management of obesity as well. They do the assessments like the functional capacity assessments, the level of activity assessments, and they are the dedicated healthcare professionals to prescribe individual exercise, and moreover, to be able to modify them, to adjust them to the current state of the person, of the client. They also take part in the prevention and treating of the cardiometabolic comorbidities and all the complications. for instance, the musculoskeletal problems or the diabetic foot. They provide musculoskeletal treatments and focusing on the pain management. Pain is an issue, is a very important issue because it acts as a major barrier to the weight loss. Physiotherapists also focus on the injury prevention during the exercises. If needed, they can provide the pre- and post-operative physiotherapy after surgeries. And no doubt, they are part of the multidisciplinary team. Let's see the impact of physiotherapy in obesity management. Individuals with BMI over 35 cost twice as much in healthcare costs for the society and for the healthcare providers than those with the BMI of less than 25. So cost effectiveness is a very important issue. I have found some recent systematic reviews on the topic, and research says that intensive lifestyle intervention to prevent type 2 diabetes among persons with impaired glucose tolerance were found to be very cost effective. Interventions including recommendations, DPP-based and non-DPP-based lifestyle interventions were also cost effective. Most of the weight management programs were cost effective as well. Besides cost effectiveness, managing the comorbidities are a very important role. They play a role in an assessment and the treatment of cardiorespiratory, musculoskeletal, neurological, lymphatic, and metabolic and other associated conditions. By managing these complications, they act and contribute to reduce the morbidity and the mortality, and also improving the quality of life. One more important issue is that physiotherapists also take part in the management of childhood obesity. And as a conclusion, recent research emphasizes the importance of integrating physiotherapy into the comprehensive diabetes and weight management, focusing on the personalized exercise regimens, addressing psychosocial needs, as well as to improve the patient outcomes. Thank you very much.
Cristina Bravo. I'm from Spain and the University of Lleida. I'm a member of Mental Health Working Group of the European Regional World Physiotherapy. This is my first slide, the role of physiotherapy in mental health, and this is the index. I explain about the mental health, the aim and the role, a specific role of our specialty, the evidence, and finally the impact of our specialty. Physiotherapy in mental health as a health professionals can be involved in the prevention, promotion, and treatment of mental health conditions. The main aim is to optimize well-being and empowerment through functional movement, body awareness, and physical activity. Physical activity has been shown to the best non-pharmacological intervention in non-communicable disease. A sedentary and inactive lifestyle is one of the major problems of mental health. Lifestyle change and self-care is one of our priorities, and as physiotherapists, through patient empowerment. To do this, we build therapeutic relationships with different strategies, such as communication, patient relationships, and motivational tools. Our focus is on the patient center with an holistic approach that includes biopsychosocial factors, including kinesiophobia, catastrophism, patients' beliefs, memories and experiences of our patients. In that study focuses on the several mental illness, including schizophrenia, spectrum disorders, major disorders, depressive disorders, and bipolar disorders. The authors review systematic reviews with and without meta-analysis that investigate physical activity interventions for major depressive disorders. Physical activity was found to be as effective as antidepressants and psychotherapy. Physical activity also improves cardiorespiratory fitness and quality of life. Additionally, supervised physical activity at moderate and vigorous intensity show greater effects. For the schizophrenia disorders, evidence suggests that aerobic physical activity reduces psychiatric symptoms and improves certain cognitive domains. In contrast, a second study which analyzed interventions for mental health prevention and well-being, positive results are found in relation to physical training programs such as yoga in the prevention of stress and anxiety in the work environment, influencing absenteeism. In this slide, I explained several evidence. The first of all is these reviews that analyze the dose-response association between physical activity and major depressive disorders. It found 15 studies and conclude that if the less active adults have achieved the physical activity recommendations of 8.8 MET hours by week, 11.5% of depression cases could have been prevented. It suggests significant mental health benefits for being physically active, even at levels below or public health recommendations. Also, in substance use disorder, have benefits of depression and cigarette smoking. And regarding anxiety, also reduce the effect on anxiety symptoms, and that other study the effectiveness of body awareness, such as Qigong, Tai Chi, yoga, and in this review, yoga was superior to controls in reducing anxiety. Another mental health disorder is eating disorders in the young people, and this evidence arises that strength training and body awareness improve eating behavior, or more relating that body awareness therapies offer additional benefits relating emotional regulation, reduce self-evaluation disorders, and enhance body perceptions. Also in all different stages of life, phases of life, in children, adolescents, adults, and in this last study that analyzed all the life, during all the life of the patients. And for the last slide, I want to present from this presentation, this strategic proposal for the European Commission that we presented last year. And that proposal includes motivational behavior and biopsychosocial strategies to cope with misuse of technologies as sedentary lives in adolescents with depressions. And that's all. That are my reference. And thank you so much.
Everyone, my name is Orsolya Batic. I'm the head of the Public Health Department of the Ministry of Interior. And I'm so sorry, but I haven't prepared for a whole presentation for you today, but I have some slides that I think will be interesting for you. And there are some slides, and now if you allow me, I would say some words about the slides in Hungarian language. Can I do it? Yes. Köszönöm szépen. Tehát néhány epidemiológiai adatot hoztam, nem egy rendes prezentáció formájában, amivel szeretném bemutatni, hogy jelenleg mi a helyzet Magyarországon, hogyan állunk európai.
I would just like to show you how are we in Europe and concerning OECD countries as well. One of the indicators is what everybody likes to use is average life expectancy at birth. Here I signaled with orange where the Hungarian data is concerning men and women. If we read all the countries, that the V4s or the countries that have similar history than Hungary does, we cannot be so proud. We are not in a situation to do so, but we have some good news because the average life expectancy at birth grows. Also in the case of men and women, but it still is under the European average. In the next graph, we can see the healthy life expectancy at birth. It's the same data, but the healthy life expectancy also in the case of men and women. Hungary is unfortunately on the bottom of the list again. We don't have a lot of reason there to be proud. And also in the case of men, the healthy life expectancy at birth in case of men is less than at the ladies. I don't know whether you know, we are an aging population here, all of us here in Europe. And in 2018 was the year when the children under the year of 5 was less than the ones at 65-year-old. So in 20 years and 30 years, the trend will go on. The 30% of our population will be older than younger. So here is the healthy life expectancy at age 65. The dark blue and the light blue parts show that these are men and women. You can see a color-coded that women have better chances there. So in 10 years or 20 years, we will be countries of older ladies, most likely.
And not only here in Hungary, but also in Europe and the developed part of the world. We could see from the data regarding death that 2 of the most serious death risks are cardiovascular diseases as well as cancerous diseases. Except 1 or 2 countries, this data is quite relevant for every country. We had believed that cardiovascular diseases only affect men. However, we realized that this is not the case. Women are also affected, and we could also see that these diseases have an effect on women as well. We have already mentioned today the lifestyle risks. I would like to highlight that we should go closer to the green area. And basically here, the food consumption for adults and the physical activity of the younger generation is the 2 areas where we are close to the green part. And in the other areas, we are quite lagging behind. This also has an effect on the risks in mortality. We're talking about sedentary lifestyle. However, we should also mention smoking, alcohol consumption, air pollution. These are all risks relating to mortality. We do know that prevention is present in every part of our life. At least primary prevention is so. However, secondary and tertiary prevention are only included in the healthcare system. Nevertheless, their effectiveness is quite diverse. Regarding primary prevention, this could state that this is the most effective, which is 25 to 30%. This relates to prevention factors on an extremely high level. So it aims to eliminate or reduce health risk factors, prevent the development of diseases, decrease lifestyle and environmental risk. So these are the tools that we could use in order to tackle these problems. What's highly important is that this figure shows that the expenditure for health, but we have to say that in Hungary is quite a low amount compared to other European countries. Unfortunately, there were 2 other countries between 2019 and 2022 where the amount spent on prevention decreased compared to 2019. It's actually quite worrying, and this kind of tasks relating to the expenditures, I could have a first-hand experience that unfortunately our financial means are not so diverse, and it's an extremely sad factor. So if you allow me to add one more sentence, that I believe that everyone knows here what we should do. We should act together, and what should be done, it should be done by us. Thank you very much.
My name is Esther-Mary Darcy. I have the honour of being the chair of the European region of World Physiotherapy. I live in the west of Ireland. The temperature here today in Hungary, in Budapest, is just slightly warmer than the Atlantic where I swim every day. I hope that this session has achieved the aim in enhancing your awareness of the role of physiotherapy in the prevention and management of NCDs. As demonstrated by all of the previous speakers, the evidence for physiotherapy is very strong. While the session gave you an overview and provided a more detail in the 3 specialty areas, these are representative examples of a wider physiotherapy role across the vast spectrum of NCDs, and obviously in particular the big 4 or the big 5 in chronic disease management, depending on how you look at it. As Grainne said, physiotherapy is the 3rd largest health profession in Europe and the primary non-invasive, non-pharmacological and non-surgical health profession. It is grounded in robust clinical reasoning and scientific evidence. And as the experts in exercise prescription, physiotherapists specialize in conducting thorough assessments of individuals, designing exercise protocols that are safe and person-specific. Physiotherapists are taking a holistic and empowering approach to make every contact count. Physiotherapists are trained in using brief intervention skills, and I was very glad to see, as mentioned by Dr. Mendes, the great document on brief intervention skills, which again in Ireland, every health profession is trained in this area. So the use of health behaviour and brief intervention skills with every patient is extremely important. So putting this all together makes physiotherapists the most highly qualified health professionals to prescribe and design exercise programs that are tailored to address NCDs. It does go well beyond, I suppose, physiotherapy and NCDs does go well beyond addressing physical inactivity and exercise prescription, again, as mentioned by my colleagues, such as treating pain, improving function in cancer-related fatigue in patients undergoing radiotherapy, lymphedema management in secondary lymphedema in patients post-breast cancer, the treatment of joint pain in people with immobility and some of the chronic diseases, and also breathing and airway management in people with COPD. Addressing the high prevalence of MSK, musculoskeletal disorders, and cardiorespiratory impairments in those living with obesity, which is in themselves is a barrier to movement. Many of my colleagues whom I've talked to in the last few days before coming here have noted a major concern about access to treatment and access to physiotherapy, and how essential it is for people living with NCDs to be able to access physiotherapy for evidence-based assessment and treatment of joint pain, decreased muscle strength, decreased aerobic capacity and function, obviously in areas as well such as mental health and in bone health. I'm really glad to report that the health economic impact of physiotherapy for people with NCDs is very positive and is evidenced in the decreased length of hospital stay, decreased admissions, increased intervals between admissions, decrease in prescribing, decrease in absenteeism, and sometimes decrease in surgery. I'm sure the surgeons mightn't like that. The physiotherapy impact extends beyond improving individual health to more productive people who can contribute to the European economy. Other evidence is in the representation of physiotherapy. And this is recognized through many health-related organizations. The European region is represented at European and EU organizations, such as the European Foundation, the European for Patient Care, the European Forum for Patient Care, and the European Pain Federation. Our partnership with the EU Public Health Alliance, our memorandum of understanding with the European Doctors Association in recognizing our autonomy, our representation by our physiotherapist cancer specialists in 3 of the working groups in the EU Beating Cancer Plan, physiotherapists holding board and executive positions on organizations such as the European Pain Federation, Eurospine, and the Euro Association for the Study of Obesity. The European region, through its working groups, has produced guidelines, as mentioned, on the role of physiotherapy in mental health, the role of physiotherapy in cancer care, the latter which was published recently in the European Cancer Journal. We've recently learned from the Association for the Study of Obesity that their impact is even wider, and that the physiotherapy assessment and treatment in children with obesity is included now in the US pediatric guidelines. The European region supports the WHO's call to address the NCD epidemic and endorses its advocacy for a primary healthcare approach that focuses on early detection and cost-effective interventions. The Europe region also calls on the WHO, the European Union, and national health policy makers and all relevant stakeholders to recognize, support, and promote the significant cost-effective contribution physiotherapists make in tackling the growing NCD challenges in Europe. I say to you, we are a solution. Physiotherapists should be integral to public health planning, policy making, resourcing, and budgeting, as well as promotion and intervention, and initiatives aimed at NCD prevention and management. Policymakers across Europe should include physiotherapists in NCD strategies. The takeaway message for today is unequivocal. As the health promotion experts in movement and exercise prescription, physiotherapists are an indispensable resource in the crucial battle against NCDs, and our role should never be underestimated or overlooked. Thank you. If I could just take one moment to say my thanks, please. And firstly, Emil, I would like to thank you for all your efforts in securing this session, and so for so graciously hosting it as well. I'd like to thank all the speakers and the panelists for sharing their expertise with us, and indeed the Hungarian Health Authority under the auspices of the Hungarian Presidency of the Council of the European Union. WHO Europe, and especially Dr. Pavlos Theodorakis, who was to be here and who was instrumental in setting up this opportunity, but has been called to another task, and we wish him well. I would also like to thank Scilla Powell for all her hard work in the operational organisation of this event, I know it wasn't easy, and we really appreciate your work, Sila. I would naturally like to thank the expert group of the European Region of World Physiotherapy who prepared this document on the role, and to the General Secretary of the European Region, Aitor Capio, and to the Hungarian Association of Physiotherapy for their great support for this initiative. And lastly, to you, the attendees, both online and in person. Thank you very much.